And I want to thank Florida Now for doing this process of education and sharing in these strange times. And we titled this, you know, and because I'm a believer in crisis, there's opportunity, and we certainly are in crisis. So that means opportunity abounds. And I'm gonna start with flipping through the crises. I will get to the opportunities, so don't despair. But, you know, what we're seeing in front of us is a lot of issues that are out there. Inequity in our healthcare systems, food shortages, people being evicted, low-wage workers not being able to make ends meet are not new information. This has been going on for a very long time in low-income communities of color. And the opportunity we'll talk about later is now that there is this huge light shining on the underbelly of our system that's supposed to protect people. We see all the holes. That gives us a better opportunity to address them. We're looking at the essential workers, our frontline workers that have been now identified in both federal and state policy, are the very folks who are primarily African American, Latino, immigrants, people who are working in low wage, no benefit jobs that we all have to have. People putting food on our tables, people serving in our restaurants, people working in the grocery stores, people picking up our garbage. These are folks that have been doing this work all along, but finally it's been acknowledged that they're essential because we want them to keep working while the rest of us can be home and safe. But it's coming up, lo and behold, that they don't have health insurance, they don't have paid sick leave, many of them don't have people to take care of their kids while school's out. They live in communities that don't have access to health care. There's not a hospital there. They're farm workers. Many of them are undocumented and ineligible for any of the services because of their immigration status. And so all of these things are right there in front of our face. And with a big healthcare crisis, hopefully more and more people are realizing that, oh, well, that affects me. When the people that I'm counting on can't get adequate health care and are working in jobs that aren't giving them protection, it might affect me. And so sadly, that tends to make people pay attention a bit more when they've had opportunity in the past and just haven't, because it was those people, it was that community. It wasn't anything that affected my children or my neighbors or my family members. So all of those things present an opportunity for us. And it's happening all over the country, particularly in the South. We have not been very good at taking care of workers and adopting programs that benefit everybody. And Florida is right up there front and center. Florida's economy relies on tourism, agriculture, retail and hospitality industries, all of them low wage, no benefit industries that are hurting big time now. People aren't coming to Disney World. Disney World was closed. People aren't flying. People aren't, traveling here and spending money. And that is gonna hurt our economy because our economy, our tax structure, and I'll mention this now and talk more about it later, but we rely on our revenue from about 80% of the sales tax. We don't have a state income tax. We're one of 7 states that doesn't have it, and it's prohibited in our state constitution. So our revenue tends to go down in a recession or a bad economy at the time when the need for services goes up, and we get hit pretty hard. When we're looking at healthcare, Florida is one of the states, like most in the South, that has not expanded Medicaid. So all these people who before people lost their jobs, we had about 1.4 million people who would qualify for Medicaid if the state were to expand it to the 138% of poverty. And that's before this pandemic hit us. I read Families USA put something out saying that 280,000 people in Florida had lost their insurance, because we tie insurance to work so much, due to job loss just between March 14th and April 18th. So we're talking about adding a huge number of people into the coverage gap. And for Floridians, what that means is you can't qualify for Medicaid if you make more. You have to be parents, so have dependent children. You can't make more than 31% of the federal poverty level. That's about $6,700 for a family of three. Yet you can't qualify for the Affordable Care Act if you are below 100% of poverty, the federal poverty level, because it was anticipated that Medicaid would be covering you. So that's who we refer to as being in the gap. Florida's had about 800,000 people in that gap from the get-go, and all we're doing is growing it. Even if we were, and also in Florida, if you are an adult without dependent children, you can't qualify for Medicaid. You could have zero income and you can't qualify for Medicaid because you're not covered. So the push is to expand it to 138% of poverty. But even if in this time we expanded to 100% of poverty, so we caught those people in the gap who don't make enough to be able to apply for the Affordable Care Act and make too much because it's above 31% of poverty, or they don't have children, we could help a lot. And our economy would benefit, because with the expansion population, we would still the state would pay 10 cents of the dollar. So the state would pay 10 cents per person, and we'd get 90 cents covered by our tax dollars that go to Washington that would be brought down into the state. Before we started into the pandemic, because we don't have a very stable revenue system and we are stingy, we rank in the bottom quartile of funding. And I know that this is particularly true across the South in particular, but Florida oftentimes isn't considered part of the South, but we very much are in terms of our funding of services and our mentality. But we were in crisis across the board as we went through this last legislative session. We have a housing crisis, a corrections crisis, an education crisis, an opioid crisis, a mental health crisis, a healthcare crisis, as you just heard. So this pandemic is just really having all of these things that were already bad exacerbated, but everybody is having an opportunity to look at them. I'm sure if you're watching any of the news, you're seeing about how screwed up our unemployment system is. I was just on a call about that before this one. We have long had a very, very low recipiency rate, meaning of the people that are unemployed, there have been 18% of those people who should be eligible who actually qualify. And in 2011, there was a whole dynamic that took place with the intent of making it harder for people to qualify for unemployment, because frankly, our business community considers the unemployment insurance trust fund to belong to them. And they don't want too many people qualifying for it, because the way it works is that you have to have a certain amount of money in it. And if you dip below that amount of money, it triggers an automatic premium increase, because this is an insurance program and the employers pay premiums. And it's an insurance program to protect employers by making sure that in bad times, workers have some money to be able to spend in the economy while they're waiting to come back to work. So the attitude was, hey, this is our trust fund, and we don't want more people accessing it because we don't want to have to pay higher premiums. And in good times, when your fund is above that line of how much has to be in it, you can either give extra benefits to workers or give a tax refund to employers. Well, you can guess what we've done over the years in that situation is we've given tax refunds. So now we're in a big mess because of the very, very, very large numbers of people who are trying to access the system. And you may hear about and read about the computer system that was designed to keep people out. But there's underlying policy that also has to be changed. A big one, many of your states modernized your unemployment system. There's only 13 states in the country that didn't when given the opportunity and the funding from Congress. Florida stepped away from, well, all 13 of the states stepped away from $400 million offered to modernize our unemployment systems by recognizing that we do computerize things now. There's a process called the alternative base where you're not allowed to count your most recent quarter of work when determining your eligibility. You skip that last quarter and go back to the previous 4. Well, guess who gets impacted by that? Low-wage seasonal workers. I became aware of it because of my work with migrant and seasonal farm workers who work until the very last minute that they can, and oftentimes that's when their wages are a little more because they're doing extra work. Well, when you can't count a whole quarter of your work and you're a low-wage worker, oftentimes you're deemed ineligible for unemployment benefits. And that was created when employers had to snail mail their wage reports up to the state capitals, and they don't do that anymore. They needed the lag time to calculate. We have computers, even when they're messed up, they file their wage reports on the computer. And so the alternative base was created to allow a worker who can't qualify in terms of their wages when they have to not count the last quarter to be able to count their most recent quarter and not count the first quarter, perhaps. So it's the same amount of work. They have to make the same money. It's just what you count. Well, we don't allow people to do that. And now when people are finally getting in to the system, they're being told that they're not eligible. This has always been going on, and some of us have been fighting it for years, but now it's out there in full color. And so hopefully we'll have an opportunity to make some of those changes. So opportunities, a little bit more of the crisis, but as I mentioned, Florida is, we don't have a state income tax. Our tax structure is viewed as being the second or third most regressive tax structure in the country, meaning low and middle income families and individuals pay a higher percentage of their income in taxes than those who are wealthier. And that's because we don't have a state income tax. And we rely on sales tax very heavily. And it's sales tax on purchase of goods, not services. When our tax structure was created in the 1940s, it was an agrarian society. We weren't a service society. And now everything is services. We exclude services from our tax structure. So as I mentioned when we opened up, when the economy's bad and we need more revenue for services, our revenue tends to go down because even within the taxes that we collect on purchase of goods, it's full of exemptions. We, in fact, exempt and exclude more revenue than we collect from our sales tax system. So Florida is not a revenue poor state like some of our sisters in the South. We have revenue, but we don't collect it, or when we do collect it, we collect it unfairly. An example of what I mean by ridiculous exemptions, some of them are good. We don't tax food or medicine or rent, and we shouldn't. But for example, if you have a pet a cat, a dog, a bird, a fish, a hamster, you will pay sales tax on the food. If you had an ostrich, you wouldn't, because the ostrich industry got an exemption, and they got an exemption because the cattle and poultry industry don't pay taxes on the food. Or if you buy a fishing pole to go out, and I say sit on the dock of the bay and fish, you pay a sales tax. But if you can pay $500 for half a day to go out on a charter fishing boat, you don't pay a sales tax, because that's considered a service. If you go to a football game at college and you sit and you buy a ticket and you sit in the bleachers in the stadium, you're paying a sales tax. If you can afford a skybox, you're not. And that doesn't sound like a lot of money, but when you start going through an entire tax structure with stuff like that, it adds up. One of my personal favorites is we give sports subsidies to sports teams like the Miami Dolphins and the Magic. And those are monthly payouts to the tune of $2 million a year for 30 years. Tax cuts are budget cuts. They're expenditures. That's money that isn't coming into the budget to be able to use on all the crises that we have, healthcare, opioid, housing, because it's going out of the budget. In addition to that, Florida, only 1%, actually a little less than 1% of our for-profit corporations pay any corporate income tax. In states that have a state income tax, a lot of that is captured. You have limited liability companies, LLCs, that revenue is captured in the state income tax. In Florida, that doesn't have a state income tax, we exempt LLCs from paying the corporate income tax. So that's a lot of revenue that goes out. It's a missed opportunity to have come into the budget to bring us up out of the bottom quartile in funding on our entire social infrastructure. And the opportunity now, with all of these needs and so many people needing assistance, is to finally address some of those revenue losses. The talk in all our states, I'm sure, is what are we going to do? Our revenue is down, the economy is bad, we have all these people out of work. We're going to have to come back in and cut services, cut the budget. Well, I would submit it's true in every state. There are ways to raise revenue so that you're not cutting, in our case, certainly, the already underfunded services that need to be shored up. We have $4 billion in our unemployment trust fund that needs to get out there. We have $4 billion in reserves. That's because we're stingy and we don't fund anything adequately, but it's in reserves. We are one of 2 states in Florida that has not yet taxed the remote sales, internet sales that's going, and we lose, the projections are that we could raise $479 million a year, which is probably higher now that everybody's buying on the internet. We're just letting that money go somewhere else. And really, as I said, we're one of 2 states in the country that hasn't done that. So the challenge is, in this time of crisis, where can we highlight and target the opportunities to make changes that have been needed forever, but that more and more and more people are aware of, that we can all stand together and say, hey, this has got to change. We're in a worse position now because we have underfunded all these things forever. Think where we would be if we had expanded Medicaid and we had all that additional money into our healthcare system that would have made it easier and better to deal with the crisis in the pandemic. So those are, that's the crisis in the opportunity in the crisis. And I think it's important to remember, I know we were talking about economics, and tax structures is not a real exciting topic. I get all excited about it, but most normal people don't. But that's because we tend to focus on the budget and the expenditures. But really, our revenue system, where that money, how that money is raised and who's paying, is equally important, because we can talk to her blue in the face about funding healthcare if in the other committees that make decisions, they're giving the money away, as they love to do in our state, to corporations. I forgot to mention, we gave corporations $543 million in additional tax cuts on top of the federal tax cuts that they got, which is nuts. It's nuts. But so those things matter. Looking at, and in those committees, mostly the people who attend them and talk to legislators are the people who want the tax cuts and who in turn give them campaign contributions. They're not having to be looking at, well, where else should we be spending this money? What else could we do with it? And they don't look at it as a cut to the budget. So that's our job to help educate ourselves and to help our policymakers understand what the priorities need to be. I once was involved in a program that said, the budget is the blueprint for our priorities. And the budget isn't just about spending, it's about revenue and how you raise it and who pays and who benefits. So that's kind of my end of rambling around. I know I would throw this in too, because I've just been made aware of it in our state, and I'm sure it's happening in other states. We apparently have a handful of legislators who are pushing our governor not to accept federal money, which is crazy. And, it's this. I listened to a Republican legislator when we were doing the Medicaid expansion debate on the floor of the House say that he was tired of hearing all this talk about how we weren't drawing down our tax dollars from Congress, because those are not our tax dollars. That's money we've borrowed from China. And when we take that money, we're just digging the deficit, So I always thought we should do bumper stickers that says, Florida paying back China. So these are all things to think about as we worry about what's going to get cut, what the proposals are going to be. But how can we reframe the discussion to, where are we going to get the revenue to make, one, our tax structure fairer, broader, and not have winners and losers in our tax structure, that allow us to combine with our federal dollars to get through this crisis, and not only get through the crisis, but do a lot of the repair work that has been needed to happen all along, and it's been ignored. That's my optimistic ending.
Thank you so much, Karen. That was fascinating. I know I learned a lot. I have an immediate question, and I'm sure other folks do, so I'll just jump in here, and then other folks, feel free to either type your question or raise your hand or just jump in afterwards. Do you see this happening? Are there people who've traditionally not been open to revenue increases that are now finally switching, or is there a needed activist push to put this on the agenda? Are there vulnerable House reps and senators in Florida that you are targeting?
The answer to all of that is yes. Yes, there are, we have term limits in Florida. So we have a lot of members who, on both sides of the aisle, but of course our big challenge on this stuff is Republican members. But there are a number who they haven't historically, they listen to the leadership. This is a very different time, and timing is everything. And so that's what gives us the opportunity, but it will only happen if there is a concentrated, organized effort to call for it and push it. We're already seeing a huge effort around unemployment benefits, and that's because everybody's impacted. And guess what? Everybody's calling their legislator, and Republican legislators have family members who have been denied coverage. So we have to stay in front of them. Medicaid, we've been working Medicaid expansion. There's an opportunity with that, with so much about healthcare on everybody's minds. So there is an opportunity. We have an additional challenge that I forgot to mention that passed in our state constitution a couple of years ago. We now have to have a supermajority vote to raise taxes, not to give tax cuts, but to raise them, which is pretty daunting, and it would only be in a crisis like this that we could get that for a limited amount of things. But there are some things that wouldn't be considered a tax increase, like collecting the sales tax revenue from internet sales, that the taxes are already there, we just don't collect them. So that's not a revenue increase. There are some gaming issues. There's a couple of things that could be done that would raise, $500 million, and that starts to add up. But I do think it's an organizing opportunity for everybody everywhere. Whatever particular thing, people are being evicted. Our Republican governor has signed a moratorium on evictions, and he just extended it to the end of May. Of course, we have the issue of if they have to repay the 3 months that they had the moratorium, that's not going to work either. But, baby steps. But there are new opportunities with new members, and we have elections coming up too. So long yes answer.
Thank you. So other folks, do you have any questions for Karen? I mean, while other folks are thinking, I want to also say that this is something that I've been hearing from legislators and activists around Massachusetts too. There's definitely, I think, the sentiment that we can't ask for more. We have to just try and hold on to the bottom line of what we were already trying to fund in the first place, which is frustrating to hear because in Massachusetts, we do have an income tax. So I didn't honestly know that Florida didn't. And that obviously shows the nuances across the country. But the other thing that I heard from the legislators I was talking to on the state level was that while the state couldn't fund new initiatives as easily, the federal government can, because they are literally making their own money or are able to do that. So I don't know, it's just interesting. Which is one of the reasons why, as a state level organizer, I am now trying to learn more about the possibilities on the federal level that aren't possible on the state level, and vice versa as well.
Well, the only thing I would suggest to that is, don't take no for an answer. People, at least with our folks and even with friends, legislator friends, oftentimes tell us something can't be done. Oh, there's no way we're going to expand Medicaid. Well, we won't if we don't try. If we quit working on it, then there's no clamor, there's no push, and we certainly won't. So yes, we're going to be fighting to make sure they don't make cuts to deal with revenue declines. Some of these things are fundamental policy changes that aren't direct budget issues, that now people are understanding that they're there. And it seems to me it might be a little irresponsible not to try to work on them. It doesn't mean that they'll all happen, but I don't know. In our state, it takes 5 to 15 years to get stuff done anyway. So the sooner you fill in the gap, the sooner it might happen.
Definitely.
And I agree with the federal opportunities there. It's making sure that that money doesn't go to backfill some other stuff, that isn't what it really is supposed to happen.
Can you explain what you mean by that, Karen? And also by that it doesn't go to fund that there were. I'm assuming that you mean by that it's not taking away from another public services program. But can you explain what you mean by that? And then also, I know that some people on the call may not understand what a supermajority is and how that impacts our ability to be able to move the legislature around tax issues. Can you also just explain that a little bit more and how important that impact is for those that don't know? And then one other ask. Would you mind just giving your experience in I find that it's really hard. I think I mentioned this before the call, but I find that it's really hard to engage people on economic justice issues, especially at an advocacy level, because it doesn't seem quite sexy enough, or there's not a human face to it. Can you explain how you use the Florida People's Advocacy Center and the work that you do at the Florida People's Advocacy Center with directly impacting people to target economic justice issues and make them more down to earth and give them a face?
Mm-hmm. Thank you, Lakey. Thank you for that. So the first question, what do I mean by making sure that funds go to what they're supposed to go to? For example, when the federal government gave states, put the money out for economic recovery, and it was supposed to be targeted for small businesses, there were a lot of large corporations who took the money. That happens on the state level too, and you just have to make sure that there's criteria there for it. Unemployment insurance, I mentioned we had an opportunity twice with money to fix our unemployment system. The first time Congress sent $400 million down, there were no strings, and Florida took the money and fixed nothing. The second time, there were criteria attached to it. You had to fix, certain things, and so we just walked away from the money. But you have to kind of make sure that there are protections, and that the other thing that we're famous for is we will take money and use it for what it's supposed to be used for, but then we'll back out the other money, the regular, we call it general revenue. That's our tax dollars in the budget that was funding it. So instead of making an improvement, we're just supplanting it. We're replacing it. That's what happens with the lottery that's supposed to go to education in Florida. So it does go to education, but we took our regular tax money out, so we haven't improved education, we've just replaced the dollars. And that's a constant struggle and battle to watch out for. When I talk about a supermajority, so when the legislature votes on most things, it's a simple majority. So you have, more people vote yes than no, and that's a simple majority. When you have constitutional amendments, there are certain issues that it requires a supermajority. So it's usually it's either a 2/3 or a 3/5 vote, and that varies. So this amendment that passed in our Constitution, which means we'll never get rid of it, requires that extraordinary vote of a supermajority to ever get rid of tax breaks. But the same thing doesn't apply when you want to give a tax break. That stays a simple majority. But to remove, let's say, the unfair exemptions in our sales tax, that's going to take a supermajority vote. So it was hard enough to get a majority. So it's very daunting to have to get a supermajority, and that's going to take strong, in our state, Republican leadership to be on board with it, or else we don't have the numbers to be able to make that happen. So that's what that means. And on on how do we get the attention of legislators and tell this story and make this stuff real for them rather than throwing numbers and statistics and all around, is that we organize and bring the people who are directly affected to the Capitol and help them be able to tell their own stories and work on this, and also help them connect the dots too about why they can't access unemployment because these policy decisions were made to keep them out. And legislators need to hear what they're struggling with to understand how that's impacting their constituents. When they can't get health care after they've been in the fields picking the vegetables that are going to our grocery stores and going on our tables, and they don't have protective covering masks and they don't have anywhere to go for health care, their legislators, the people who make decisions, have to know about that. And so the center, and that's been my way of organizing for lobbying forever, because my background is in community organizing and social work. So that's how I approach it.
It says that it was the mounds.
Yeah, and it put the face on these issues, and more importantly, and we've come to the point of having the center, is that a place, Tallahassee is not close to anything. Miami is 500 miles from Tallahassee. Orlando is 4 hours. Tampa, people can at least drive in the same day, but having a place to stay makes a big deal for people to be able to come up and afford to stay, but also having a place where they can train and understand what's going on at the moment is helpful. And when we have rooms that people can sleep at and a big kitchen so people can, share stories and work together, coordinate strategies. And that has been the way, it's really these days the only way we make change at the Capitol. We have to be able to have a consistent presence. Typically people want to bring a couple hundred people up one day or 2 days, and then go away. So everybody loves children when it's Children's Week, and then they leave, and then they don't fund their budgets. So it's helping, and our folks can't learn the process when it's like a drive-by field day. It takes, sitting in committee rooms and listening and going and talking to staff people and catching the legislators in the hallway and making them have to look at you with your children while they're having all these discussions. We call it the eyeball effect. I call it the eyeball effect. So it's a critical part of working in state capitals, and I'm sure all of you who do that know that how important that is. It's not easy because other stuff you're working on is going on then, but it ultimately is very powerful. And in this time when so many people, so many constituents of legislators who never would have been impacted by any of this have been, targeting people that a Republican legislator doesn't usually hear from to go and talk to them or to share their story is going to be very powerful.
I love it. Well, I am fired up to call my legislators back and let them know what I think. They should be voting on the state and federal level.
Mm-hmm.
And I'm sure that lots of you are also have a long ongoing list in your head of initiatives that you are fired up and passionate about too, related to now's priority issue areas. And so feel free to get connected with your state chapter to find out what local initiatives they're doing, and stay tuned to hear from more now webinars and programming and action alerts that are coming down the pipeline. I think that we will be sharing this recording with all of you as well. And if there's other resources, Karen, that come to mind that you think we should be passing along to folks, we'll be happy to do that as well as a survey or evaluation for you to let us know how we can make these better. I want to pause the pregnant pause, if you will, one more time, just in case folks have any more questions or lingering thoughts.
Yeah, I'm just thinking about the almost unsurmountable task that's before us. Florida did a nice job redistricting so that the rural areas of the state tend to way over represent the urban areas. Black and brown people, people of all color, along with the immigrants, along with the people out of prison. Someone mentioned Proposition 4 that we passed, but that the government is against. I know I was a guardian ad litem. Foster care in Florida is in terrible shape. We have problem after problem, and certainly now cannot do it by themselves. So I'm wondering, what are the tie-ins with the League of Women Voters, with ACLU, with all the other organizations that are trying to get out to vote and make things change?
Karen, do you want to answer that, or I can? I'm sure we both have different.
Yeah, and when Lakey can chime in too, we have extraordinary coalition partners in Florida, and we only move this stuff with working in coalition, identifying their members, helping their members to support. We're trying to break down silos. That's one of the goals at the center, is when you have the state of Latinas at the Capitol, followed by Black girls at the Capitol, and they're both staying at the center and they're both supporting each other. And then we have Muslim Day and folks are up and everybody is learning about each other's agendas and supporting each other's agendas. And you're right, Les, it's important that we all work together. And it doesn't mean we have to take the lead on everything. Different groups focus on different things, but it's about standing there. Even if you go in Florida, you can go to the Capitol and fill in an appearance card and check whether you're opposed or supportive of something, and you don't even really have to be there. You put it in and it goes into the record. So there's all those kinds of things that are important about working together in coalition.
Thank you.
Lakey, sure. Lakey, did you want to, we work with Equality Florida, we work with Planned Parenthood, we work, and we don't all, Southern Poverty Law Center, ACLU, we don't, everybody doesn't work on everything, but pretty much we're all aware of other issues. And when we need to pull everybody in to put a card, they come. We do it.
Yeah, and I would say that the well-funded not-for-profits like the ACLU and the League of Women Voters, it tends to be a little bit more well-funded than some of the more direct, really grassroots organizations doing GOTV stuff. I would say that I think that we agree, one of the things that Florida People's Advocacy Center does really well is coalition partnerships throughout the year. And then during the legislative session, we have weekly allied partner calls. Everybody alerts each other to different bills, and then we try to show up to different people's actions. And we bring in youth and young groups like the Dream Defenders, who also do a really great job of doing GOTV stuff. Even faith-based groups that are getting involved in advocacy work, like the AME churches, and then of course in Florida with Amendment 4 and the disenfranchised voters, and we've seen a lot of action around the most recent legislative attack. I think that one of the big tie-ins for us is that, and I'm sure that Karen can qualify this, but there seems to be, annually during election year, there's there's a big rollout for get out the vote and party politics by national and state organizations. They hire organizers and then they walk away when the election is over. And that's so getting out the vote is only 25% of the problem. I don't even think it's 50. I mean, Karen may disagree with me, but it's really not even a 50-50 play, because getting out the vote to get people even to vote for the ones that you want in office doesn't keep them accountable throughout the year while they're in office. And so getting out the vote and then walking away isn't enough. And so those groups and the groups that you named, Les, are not the ones that are walking away, right? Like the ACLU has a lobbyist. The League of Women Voters are annoyingly present to their legislators all year long. So it is, I think, a part of the lesson that we shouldn't wear ourselves out or dump a lot of money into just GOTV and then walk away and leave unfunded the follow-up accountability process, and that also educates people to what the legislatures are doing, and the legislatures are taking issues into their own hands. And the only other thing that I think I would say is that you started your comment, Les, that the task ahead of us is daunting. And I think that's part of what scares people off, right? They look at a big picture. And the one thing that I love about the work that Karen does is that she always brings the power back to the single individual or small group, and the direct impact. I mean, I'm super impressed that she's here on the, using technology, but that face-to-face connection, that interaction with your legislature, that showing up, and we always put this emphasis on lobby days and people coming in mass, but you bring one trans child to the Capitol to speak to a conservative legislator about what trans justice is about, and one incarcerated individual that couldn't get into housing and couldn't get a job, and talks to a legislator, and you have more impact. And so I think that each state, one of the reasons why I follow around in Karen's footsteps is because the model that she's created is substantial, and I think that it's one that we would like to see in more states, which is the empowerment of small groups of people. That doesn't have to be these big, well-established, moneyed groups. That it can be like we have this group, Black Girls Magic, right? And the woman who started that is now running, right, for House representatives, and made like 3 times more money in her first week in her campaign and donations than her like Republican counterpart. And she is young and Black and a woman and dynamic, and she walks into that Capitol and there's a fire blazing behind her. And it started with a small group of really powerful young Black women showing up to the Capitol, and people like Karen supporting them. And I think this last year, she had like over 100 Black Girls Magic people come from all over the state, and it was a combined partnership with the Dream Defenders and other groups. So, I think that that's the power that we need to infuse. And I'm so grateful to be able to work with Karen, because it can get really hectic in Florida. The big picture seems daunting.
Okay. You bring up an interesting point, and most of the progressive organizations that you were talking about do not have enough people of color involved as members and as active people. And I know, because I've been involved in efforts to reach out to the colors community, it's difficult. So we got to redouble our efforts somehow, and bring these folks in, because they have stories to tell that are really powerful, as you're pointing out. So enough for me.
Thank you.
Some good stuff. Thank you, Karen.
Sure. Thank you. Thanks, everybody. Do you, Sasha, do you guys in Massachusetts do, I'm sure you do efforts where people come in from communities?
Well, are you talking about coalitions or are you talking about like lobbying?
Yeah, well, coming in to lobby in coalition and with community members.
Yeah. So in Massachusetts, we're a part of a coalition for choice that has like the NARAL, Planned Parenthood, ACLU, and then other kinds of organizations along those lines. And then we also are part of a really big suffrage centennial coalition in Massachusetts. And on the national level, I want to share also actually that we are a part of the We Demand More coalition, which is demanding more money for exactly the kind of services that we're talking about for women, for parents, for poor people, for immigrants. And so stay tuned for a nationwide call out on Tuesday, where we're going to hopefully be able to activate our now members and be calling legislators in those vulnerable states. Florida and Massachusetts are not those, but think of Arizona, think of Texas, think of Colorado, think of Maine. And that's some national coalition works that NOW is a part of. And Mass Now also started the first ever Massachusetts Menstrual Equity Coalition last March. And that's because our bill that we are first and foremost pioneering is to have menstrual products be free and accessible in schools, prisons, and shelters. And so, of course, there's money associated with that ask that we are in the process of working through with our state house as well, but also on the federal level. So coalitions is how this work happens, and I think the consistency is throughout the year, throughout the legislative cycle is key because we are not taught this on purpose. So we have to teach organizing, and that is totally the purpose of these webinars. Mass Now also restarted consciousness raisings, which Karen Lakey and I were talking about separately. And the goal of consciousness raisings is literally to strengthen our personal stories, strengthen our personal narratives around our life, talk about our truths, because in fact, no experience is necessary to talk to legislators. But a lot of the issues that we are working on have never been talked about in the State House before. And there's a lot of shame and stigma around that, especially as you can imagine around periods. The Massachusetts legislature has never talked about periods in its hundreds and hundreds and hundreds of years of history. And so Mass Now and Now's role in this movement, I think, is to be bringing our members together and reminding us that our truths and our lived experience is all it, and coupled with amazing research and academia and in, amongst us, is all we need to lobby. So definitely rings true.
So there's a hopeful note that 2 years ago, a coalition led by formerly incarcerated women lobbied to get healthcare items, tampons, menstrual pads, all that stuff for free to everyone in prison, to women incarcerated, because people were having to pay for it. And it was 2 male legislators who filed the bills for them. That it passed unanimously through every committee and on the floor of both chambers. And I always joke that I think it's because they didn't want any conversation about it, because they didn't want to talk about tampons on the floor. But I mean, it's encouragement because stuff doesn't pass the first time it's filed here, but that was created by and driven by this coalition called the Dignity Coalition. And it's Dignity for Incarcerated Women and Girls, led by formerly incarcerated women and girls, that has grown and is taking on additional issues now. So if Florida can do it, Massachusetts certainly can.
I'll take that. I'll take that encouragement for sure. Awesome. Well, I'm sure we could all talk forever, but I do want to thank everyone once again so much for coming. Share something that you learned today with 5 people you know, and we will have just maximized the grassroots power of this webinar. I will be emailing you a version of it, so feel free to send that around as well. And thank you for being now members.
Thank you.
Thank you. Stay safe,
Thank you.
everybody.
Yeah.
Thank you, everybody. Thanks, Sasha, for hosting.
Yeah, of course.
Nice to meet everybody.
Nice to meet you too.
Bye, everybody. See you
Bye.
later.